A regional event that is being expected by every first lady in Africa to take it as a mandate to launch this particular activity as their commitment towards elimination of mother-to-child transmission as well as other sexually transmitted infection in Nigeria.
We have 2.1 million children living with HIV worldwide. Unfortunately, over 1.4 million, two-thirds, are living in Africa. And without treatment, 50% of these babies will die before they are 2 years old. As it is, UNAIDS figures show that only 52% received life-saving ARVs, antiretroviral drugs, at the end of 2017. HIV in Nigeria was first reported in 1986, and incidentally, it was a teenager, a young girl, who was the first person officially reported. The national prevalence for HIV in Nigeria as of today is 3.0, and that translates to 3.1 million people who are living with the virus. Nigeria is estimated to have 220,000 children infected with HIV. The country is committed to the goal of eliminating mother-to-child transmission, and to achieve this goal, we have to ensure that more than 90% of women have access to prevention of mother-to-child transmission of HIV services, PMTCT. With the ARVs given in PMTCT, you can reduce transmission to less than 5% and even less than 2% in some scenarios. I want to appreciate at this point the donation of the HIV syphilis dual test kits by the Organization of African Ladies earlier, which we used for a survey. And we would appreciate if we can continue to be lifelong champions of PMTCT and pediatric ART. We would also appreciate assistance with resource mobilization at all levels, increase the awareness and sensitization of the services that are available so that our women and children can access them, and collaborative efforts with all stakeholders. Thank you very much.
We plead that the government of Nigeria make HIV services available at reasonable or no cost at all. We desire to live healthy and productive lives, thus urgent need for nutritional care and support and other services that give us healthy and long life expectancy, so that the free-to-shine goal of eliminating HIV in young persons can be actualized.
I commend the passion and efforts of the wife of the President, Her Excellency Dr. Mrs. Aisha Buhari, in advocating for the well-being of women, children, and adolescents in Nigeria. Ladies and gentlemen, our common goal is to halt and reverse the spread of HIV. The Free to Shine campaign is a reinforcement of the political commitment to control HIV and AIDS in Nigeria. The national and state agencies for the control of AIDS remain committed to our mandate, and we are ready to assist and support all the wives of governors as they roll out this campaign.
Many women are not aware that these services exist or cannot access them due to cultural and traditional practices. Another barrier is often the need to pay user fees and absence of health insurance, to mention a few. These are areas where your influence, Your Excellencies, can make a great impact, ensuring that pregnant mothers are tested for HIV and that those who are HIV positive are placed on treatment as soon as possible. The United Nations is therefore encouraged by the launch of the Free to Shine campaign in Nigeria today. Be assured that the United Nations system stands ready to provide our full support to ensure the success of this campaign.
The First Ladies committed themselves to the launch of Free to Shine campaign with the aim to end childhood AIDS in Africa by 2030 and keep mothers healthy. The campaign also aims at unite people and organizations at local and global levels to advance healthcare delivery that will contribute to ending childhood AIDS. For Nigeria, as the second largest HIV epidemic in the world and one of the highest rates of new infection in sub-Saharan Africa, it became more pertinent to launch the Free to Shine campaign. It is also to note that many people living with HIV in Nigeria are unaware of their status. Despite this challenge, Nigeria is committed to ensure that the vision, mission, and objectives of the Free to Shine campaign are achieved in the country. As UNAIDS Special Ambassador to the elimination of mother-to-child transmission of HIV and the promotion of treatment for children living with HIV in Nigeria, I have more reason to ensure this happens. Ladies and gentlemen, my vision in this campaign is to end childhood AIDS in Nigeria and keep mothers healthy. I therefore invite stakeholders in the HIV response in Nigeria to pay particular attention to the following issues that are key to the reduction of HIV among mothers and their children. It is hoped that Nigeria will lead the example to the rest of the world with this campaign.
It is my privilege at this point to call on Her Excellency, the wife of the President of the Federal Republic of Nigeria, Dr. Mrs. Aisha Buhari, who we are here to support on this program, to now unveil the Free to Shine logo. Your Excellency,